Welcome to Think Like a Pancreas, the podcast, where our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information contained in this program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Please discuss any changes to your treatment plan with your personal healthcare provider before implementing.
Welcome to Think Like a Pancreas, the podcast. I'm your host, Gary Scheiner, owner and clinical director of Integrated Diabetes Services. The title of today's session is Taking Diabetes Tech to the Next Level. Diabetes tech is exploding, not literally, hopefully, but it's exploding worldwide. But a lot of us struggle to understand how the various options compare and how the functions compare between different systems. Today, you're going to hear from not one of the top, but I consider the top expert in diabetes technology. I call her not an expert, she's a techspert. She knows this technology like nobody else. Dr. Inge Van Boxelaer. I'm trying to get her name pronounced just right. I hope I got it well. Inge is an endocrinologist in Belgium, and she's on a mission to improve the lives of people with diabetes by making sure that both healthcare providers and people with diabetes are up to date on all the latest in diabetes technology. She has a platform called Diabetotech, and it's recognized as a top international resource for insight and education. And we'll talk more later about that, and we'll certainly have information about it posted in our show notes. But Inge, welcome. Tell us a little bit about your background and what got you to this point.
First of all, thank you, Gary, for inviting me. I'm truly honored to be on the Think Like a Pancreas podcast. It's really a name that everybody knows, Think Like a Pancreas, and then you invented it a little bit, so congratulations.
I should write a book about that. That would be...
Yeah, that would be so great. Congratulations with your new book, the new update that's coming out. I just heard about it, so it's going to be amazing. I'm definitely going to buy it and read it. I'm looking forward to all the updates.
I will send you one, don't worry. The technology changes pretty rapidly. Between the first and second editions, I think there was 9 years. Second to third was 6 years, 7 years. This one was only 4 or 5 years. Things are changing so quickly. So I had to do almost a complete rewrite. All the automated features that we have now and all the connected devices and new software, it's really changed things quite a bit. That's your area. How did you learn about all this over the years?
Well, so I'm an endocrinologist in Belgium, and we mainly treat adults with all types of diabetes. And I've always been interested in technology. It started when I first went to ATTD 10 years ago, where they saw the first children that were using these computers next to their bed and they slept through the night for the first time, and the parents were crying from happiness. And every year there was such a buildup of this technology that we finally even had it in our hands in 2019. So I was so excited to start it. But then I saw, unfortunately, there were quite some barriers to start these AID systems. You do need some background, and your whole team needs to be trained to support people on these systems. And that's where I saw the biggest barrier, that we didn't have any videos available yet. It was more representatives that gave in-person training, which took quite some hours, and it was not difficult. It was very difficult to get the whole team in one room. And that's where I got the idea, let's make videos of this onboarding education and all the things the care team needs to know, so we all have confidence to start these systems better.
Yeah, I've had the privilege of seeing some of the videos that you've produced, and you actually let me participate in some of them.
Yeah, thank you
so much. They're really well done. I always found it not ironic, but really sad how little most healthcare professionals know about diabetes tech. If you bring your car to the shop for repair, those mechanics, they're trained and certified on everything under the hood.
Yeah.
But if you bring yourself to your doctor or to your nurse, the tech that you're using to manage your diabetes and keep yourself alive, most of the time, they know little to nothing about these. Is that your experience as well?
Yeah, I think especially in Belgium, it's with the physicians, as like in Belgium, the nurses are very well trained on these AID systems, because here we do the onboarding ourselves. So we have it's not a company that trains the patients, it's really the nurses that onboard the patients. So our nurses, they know the systems very well. But the physicians, they don't really know how to do the button pressing. And if we want to change the carb ratio or the insulin sensitivity, we would have difficulties finding it on the pump. So yeah, I think it's definitely a problem if your nurses have gone home and you're doing late consultations or early consultations and the nurse is not there. It can be quite tricky, and it's also kind of weird to ask to say, yeah, I don't really know how your pump works. So
troubleshooting also can be really
yeah.
tough if you don't understand the ins and outs of the devices.
Yeah,
And
if
it's more
people
than
are
just
complaining
pumps.
of something and you don't know the typical where everything is regulated or where the alerts are to check which alert is this person talking about, then yeah, it's difficult to help.
Yeah. And you got infusion sites and infusion sets to deal with, and you got the sensors to deal with, the
Yeah, and you really should
algorithms.
know all the options and the difference between the options to support the people. Yeah.
Yeah. So what are you doing to help the healthcare providers be in a better position to help their patients?
So after I made those first courses, we now have like 10th generation of the online course available on the website. We have in total actually 30 courses on 30 different devices now. So all the most used sensors, pumps, and AID systems, the onboarding training is there. So with all the button pressing, with all the videos on how to change it and how to interpret the reports. And it's all accredited. So for physicians who need some points, they can get some points via the website. A lot of it is free. It's actually 7 days. Everything is 7 days free. So you can do, if you have a lot of time, the whole training and a lot of points ready via
That's
our website.
amazing. And to get continuing education credits along
Yeah.
with it is pretty impressive.
There is always some point in the year that you need some extra points, right? So
yeah, in every area. I'm a certified diabetes care and education specialist. We need continuing education to maintain that as well. So it's something that folks can access. And we'll have links to that in the show notes for today's program. In Belgium, do you measure glucose in milligrams or millimoles?
Milligrams, but the courses are made for international public. So everything is in milligram and millimole, in meters and inch, and all that stuff. So we do all the metrics.
The technology is available. Every country, we've got things available to us, but I find when I work with international patients, sometimes they have access to things that I don't even know existed because we don't have them in the US. And sometimes they don't have access to much of anything. Mm-hmm. So do you work with only patients in Belgium, or do you work with people in other countries as well?
So in Belgium, like virtual care is not really reimbursed. So, and we cannot do non-reimbursed care. So yeah, I only see patients from Belgium here in this room. It's
so
very,
using Belgium as a case, as an example, how difficult is it for a patient to access pumps and sensors and the insulin that they prefer and other medications for that matter?
Yeah, I think in Belgium we're very privileged because it's we not only have free insulin, but we also have people with type 1 diabetes. They have free sensors, free pumps, free choice of all the devices available in Belgium. They have free choice of hospital, of healthcare provider. So yeah, I think they have very good care. Like they even have reimbursement for diabetes education as much as they want, dietitian, psychologist. So yeah, I think it's a dream scenario for people with type 1 diabetes. Mm-hmm. We don't really have like all the reimbursement that you have in US for like sensors for people with gestational diabetes or people on basal insulin or people on orals. We don't have that kind of reimbursement, but people in type 1, the lobbying was very well done. So I do want to congratulate Professor Mathieu for that one because she's from Belgium and she made that happen. So yeah.
We type 1s we're not exactly quiet people.
No, there is a lot more lobbying for type 1 than for type 2, right? Yeah. But yeah, they made it happen.
Yeah, we raise a lot of ruckus when we don't feel we're being treated fairly.
Yeah, and you should be. I think it's bad enough that you have this disease. You should be taken care of. I think everybody.
What are some of the hot items, devices in Europe that Americans may not be familiar with? I was at the ADA scientific sessions and I saw some things there that just blew me away. There's a company that's developing a 3-year sensor that's implanted in a vein. So there's no lag time. It's measuring glucose in real time in the bloodstream, and it's implanted for 3 years. The thing is functioning, doesn't need any
Is that the
maintenance,
GlucoTrack?
charging.
Is
That's
that
the
the GlucoTrack?
GlucoTrack.
Yeah, it's amazing. And I think the
Yeah.
accuracy is so good. Yeah.
Yeah.
But we
And
don't have it. It's
they're
all
only
in just,
testing it in Europe right
yeah,
now. And
yeah.
it seems like a lot of things are in Europe before they make their way here. So what's got you excited?
In Europe, like, to be honest, we are all very much Medtronic here in Europe. Like, Medtronic is everywhere and all hospitals have Medtronic. And we are so happy with the Minimed 780G. We have the Simplera, which has a lot of production problems at the moment. So they only get one Simplera and then they have to come back. But so this is really in use. So we have some devices that you don't have in the US, but we mainly use the devices that are US based, to be honest. So now Insulet is finally here also. So everybody's like, we finally have a patch pump. But what we also have in Europe, and which is very popular, is the Ypsomed with the, the one that's also being used for pregnancy, and the Libre 3 option is very popular. But unfortunately, you have now the issues with the pump cards that are no longer being made, and they're having some how do you say it, not enough pump cards for everybody, but yeah, I'm sure they're going to make a solution for that, and also their infusion sets. But still, it's a very popular pump at the moment,
Yeah,
because
Inge,
it's
what do you
app-based.
like about the Ypsomed device?
I think I like the size of it. It's smaller. It was easier to refill. It's with an app instead of on the pump, and the sensor. I mean, yeah, the Medtronic sensors are just not as easy as they Apple sensors are very good. So
I have a few patients using it, and the algorithm seems to be a very intelligent one. It does a very nice job of self-adjusting.
yeah, I'm not sure about the results compared to Minimed. I do think the Minimed has the best algorithm, but I know that I have some patients who are waiting and waiting for this pump to start, because we are on the waiting list to start, because they have these low targets and they want to have low sugars, right? People want to, and yeah, with the targets as low as 80, some people are waiting for that. And of course, for the pregnancy, I think, it's probably the best option at the moment.
Sure. Do you have much interest or use of open source like DIY systems?
No, I love DIY. I think the community is amazing. I love their mentality to just do it. They made the whole AID space happen, and they keep being in front. It's amazing, because these companies, they have so much more resources, and then the open source, they are always in front, and that's so cool to see. But there's not a lot of people using it, to be honest. Like in Belgium, you have free pumps now we also have Insulet. So at the moment, not a lot of people using it.
Yeah.
Yeah.
I mean,
do
it's
want
no
to
wonder
mention.
they're able to innovate quickly. When you don't have
Yeah.
to
Yeah, you don't have the
do
rules.
clinical studies and
I know.
submit for approval and wait and wait and wait. You can
Yes.
make changes pretty rapidly.
But
Now,
at
some
least there's
people
one
feel
group doing that, right? And it's
yeah.
all, they do it in their free time. That's also the cool thing, I think. Yeah.
Yeah. And they talk to people before implementing these to make sure they're safe. And to
Yeah.
this point, they've been very safe systems. Sequel Medical is launching their Twist system now, and it's using the Loop app, which was the first open source DIY system, but it's several years out of date. It's an older version of Loop, because it's had to go through all the process to get approval. So it's still a great algorithm, but it doesn't have all the advanced features that the current version has.
But still, it's going to be the first that has like the watch control. I think that's very cool. And it's still going to be a first in a lot of things. But it's amazing that even if it's just an older version that they are still in front of the other AID systems on some points.
Yeah. Any other cool tech that you've come across recently?
Yeah, I had because maybe you're interested from the US, I have here the Kaleido 2, which is the updated version of the current Kaleido pump with all the cool colors. And it's going to be a little smaller.
That is tiny.
It is
Wow.
tiny. And if you look at it next to Omnipod, I think, and it feels very smooth. It's still a little bigger than Metron, which is also available, like not in Belgium, but in Netherlands and in Eastern Europe. A lot of people are using Metron, which is especially compared to Omnipod, it's very small. It's a little bit like the edges are not as round, but people really like this small pump also. So, and a lot
How
of
far
open
does it
sourcers.
project off the skin? That's an issue a lot of people have with the
It's the
pods.
same. It's the same. It's the same. But the edges are not as round. So like maybe it bumps more, but it's still smaller. So people like it. And there's actually also a 300 unit version, which is kind of the same size as the Omnipod. And they're also not that expensive. So
Yeah. Do you ever have your patients use concentrated insulin in the pumps?
we're going to start doing that, but I haven't done it yet because now that Insulet is coming, I think it's going to be, there's going to be some candidates for that. But before we mainly used Medtronic and Tandem, and there it was not really necessary because the reservoirs are bigger and you can just change the reservoirs quicker. Yeah. And also in Belgium, we don't have any reimbursement for people with type 2 on pumps. So most are type 1 and they use less insulin.
Okay. Oh, that's unfortunate. They can
Yeah, that's
really benefit.
unfortunate. Yeah, we don't have it all yet.
Yeah, hopefully it'll move that way, especially with the automated systems.
I
find
know.
people with type 2 can really benefit from the automated adjustments.
Yeah. But then now we just came in with the Monjaro reimbursement. So let's hope we can get all those people with type 2 on less insulin.
Yeah. Yeah. So are you able to get reimbursement for GLP-1 medications for type 1s there?
Well, I think we take a similar approach as in the US, where you say that people with type 1 who are obese, they have maybe also a sort of form of type 2. Like we haven't have had any denials yet, but it's a tricky situation because it's only reimbursed for people with type 2 diabetes. So we have to state that the person also has type 2 diabetes. So yeah.
Yeah, we started calculating insulin resistance based on, how many units do you require per kilo of body weight? And
Yeah.
establish this person is insulin resistant type 2 as well as type 1.
Yeah, so I am very happy with all kinds of publications that follow that line of thought. And then when we get a denial, maybe we can show that.
Yep.
Word from our sponsor. Byram Healthcare understands that managing diabetes isn't one size fits all. With a full range of CGMs, insulin pumps, and diabetes supplies from top brands, Byram makes it easy to get what you need, hassle-free, shipped right to your door. And Byram's team of experts helps navigate insurance so you can focus on living your best life. Ready for better diabetes care? Visit byramhealthcare.com/podcast or call 866-692-8024 and select option 3. And now back to our program.
All right, so I'll put you on the spot a little bit. And Grant, this does not reflect anything about your employer or the companies you might do work with, but I want to know what you think are sort of the best in class, the best devices, items in certain categories, and why. Let's start with CGM, continuous glucose monitors. Do you have a favorite?
I like both Libre 3 and Dexcom G7. I like them both. I think the companies are doing their best to level with each other. I like their readout programs. It's very quick, very easy. They give free sensors when the sensors break. They send them to patients' home. Yeah, I like the support. Yeah, those are my main favorites. Yes.
Okay. Fair enough. I would agree with you on that.
Yeah.
We've had historically great success with the Dexcom products. They've had some quality control issues recently that they're working through, but they've been like really cutting edge in terms of advanced features and user friendliness, and even the alert settings can be customized really nicely.
I think Dexcom it has more options, but and Libre is very easy. So I think they're both very good, and I love that every year they have some new features and they keep developing their products. So it's amazing.
Yeah.
Yep.
Okay. Insulin pumps. Do you have a favorite?
We have most people, as most centers in Europe, on the Minimed 780G. The results are amazing. People are very happy. And although it's
let's talk about just the pump. Ignore the sensor and the algorithm, just the physical pump itself.
I know, but I wanted to say they don't want to give it back because of the algorithm. But of course, the pump is the worst. It's the worst, but they don't have another yet. yeah, it just gave me so much pleasure to change people's lives with the system. But you're right, it's the algorithm. For pump, I think I would go for the Omnipod. I'm so happy that we have it finally, the Omnipod 5. Before, like, I tried to convince all my patients to go on AID, and they all said no, because they saw the pump. And now with this one, they're all saying yes. So
Yeah.
I'm
You
really
can't
looking
beat
forward to
that
it.
form factor, although the Metrum that you showed me
Yes, but we don't
also.
have that one yet in Belgium, and there is no publications on this one. So it's going to be like a bit of a risk, and it's AI, and we don't really know how it works, but
Yeah.
it's actually being used, and the reviews are good. So, and there is some
Mhm.
publication. So yeah, this one, I guess it's bigger and more trusted, and we don't have the Metrum yet in Belgium.
Yeah. And yeah, from what I've seen and read, there's a lot of companies developing the patch pumps. Beta Bionics is working on them called the Mint. See, Tandem is working on their Siggy.
Yeah,
So Medtronic's, well,
Medtronic.
MiniMed now.
If Medtronic
We
is
got to
coming,
think about renaming it MiniMed. You got to change the nomenclature a little bit.
yeah, it's going to be the Flex, right? The Flex pump
Flex,
from
yeah.
Medtronic. I'm really looking forward to that, but they're not on the market yet. So let's see who's first. I think Medtronic Insulet is going to gain some market here.
Yeah. What about the algorithm, that little computer software that does the automated adjustments on the user's behalf? Do you have a preference of a certain system for that?
Yeah, I already mentioned that we are very happy with the Minimed. I think it's really easy as a healthcare provider also. There's not much things you have to change. Like with Tandem, you do have to be a little bit more looking at the data and changing to get really the results of the studies. While with Minimed, you see the results that they show. Algorithm wise, to be honest, I think but it's difficult to say as there are no head-to-head studies. And then we saw this recent study that maybe the Guardian and the Simplera sensor are measuring a little bit lower than the Dexcom sensors. So I will be very interested to see the results of the Minimed with the Abbott sensor. I hope that it will come soon, and then we will be able to truly compare them. But
Yeah,
I do
I know.
believe that Medtronic is going to be even better with their next algorithm. At Medtronic, they're so excited about their next algorithm and the updates of their algorithm. And so even though maybe, this algorithm, we don't have any comparison, I think their next algorithm is going to be very good.
It struck me that all of these companies are working so hard to automate bolus delivery as well as basal.
Yes.
They want to make it so the user does not have to announce their meals, count carbs, estimate carbs, do any of that. And, they're still coming up short. When people announce their meals and bolus in advance, you can always get better glucose control than waiting for the system to realize you need more insulin. I wish they would invest some of that in behavioral research into, well, what do we just have to do to get people to bolus, to tell it they're about to eat, instead of trying to avoid that so much. Any thoughts?
It reminds me now of the missed bolus alert of the InPen, which is now available in the InPen, which is like a cool alert, but of course then it's too late. So they should be reminded before they eat, right? Yeah. Because the missed bolus alert is the same as the algorithms that are going to be used not to bolus anymore. So yeah.
The pumps have those alerts also. You can set customized time frames.
Yeah, no, but the missed bolus alert with the InPen, it's actually based on the glucose. It's not based on the time frame. So if the glucose goes up and they see that you didn't bolus, then they say you probably ate. You missed your bolus. So it's like it's already more advanced, but
so it's prompting you to give insulin.
Yeah.
Yeah.
And I also think, if you're saying like, why aren't they not doing more research on bolusing? I do love the results of the pramlintide, doing a little bit of pramlintide in your pump and then having just slowing down the absorption. So the algorithm of the meal recognition works in time of getting the bolus there. Maybe that will do the trick. Maybe then we go to 90%.
Well, Similan is being discontinued, so we're going to have to look for other sources for the amylin hormone now. Getting people to bolus is a challenge consistently, and getting them to pre-bolus is even greater. There's a pediatric endocrinologist at Yale named Bill Tamberlin. I don't know if you know his name, but pretty famous guy. But I heard him speak at one of the Barbara Davis conferences years ago, and his approach working, especially with teenagers, to get them to give their boluses, to prompt them, is he made these little stickers up that he would put on their pumps. And it just had 4 letters, TTFB, which stands for take the flippin' bolus. And the kids got such a kick out of it, and it actually got them to give their boluses more regularly than without the stickers. So the algorithms, you do like Medtronic, and I certainly agree with that. The tandem algorithm it's a simpler one, and they're very transparent about how it works, but I think it does require the user to get their settings dialed in a little bit better, both basal and bolus settings. The open source algorithms, though, how do you think they compare to Medtronic's?
That's a good question. I think the newer, like the basic open source, but if you start using AutoSense and those dynamic insulin sensitivity factor and those unannounced meal features, I don't know. What do you think? That's a good question. Would they be better than Medtronic?
I've found them to be better than
Yeah.
any of the commercial algorithms, whether it's Loop or Trio. I find that the secret sauce is that they account for active carbs as well as active insulin.
Maybe
The
that's it.
commercial systems don't do that. So they do a better job of predicting where the glucose is going to be going. And they're not just looking 30 to 60 minutes ahead, they're looking 5 hours ahead. So they're able to make better predictions and make better, I think, more appropriate adjustments for the user.
Yeah, if you look at the results of the closed trial that they had like non-inferiority if they're not bolusing, that's not what I'm not sure if you see that with Medtronic. We have a lot of patients that are not bolusing, but their time in range is less. And so in the closed trial, it was the same time in range, but yeah. So yeah, they may be better on some points.
Yeah. And for some people who
Yeah.
are more engaged in their day-to-day
Yeah,
management.
it's not as easy. Yeah, it's not an
Right.
easy system.
Do you have any experience with the iLet from Beta Bionics?
No, I made a course on it. I think it's amazing. If you look at the results, I love the system. Just putting in the weight and then putting it on. I wouldn't even dare to invent that system, but it works amazingly. So I don't have any experience but I made a course on it and yeah, it looks really good. And I love that they're progressing so fast with their integrations and the updates of their pump. Yeah, it's a fast company. Unfortunately, they do not intend to come to Europe at the moment.
At some point. But from a healthcare provider's perspective, it's a dream because
it's a
virtually
dream.
nothing you have to do. No
Yes.
settings that have to be, no fine tuning of the settings at all.
Yes.
And for also, users, there's that simplicity of just estimating small, medium, large meals. And
yes.
There was
and
some
in Belgium,
data presented at ADA about that, entering small, medium, large carb amounts instead of exact carb counting. And with AID systems, the outcomes are very similar.
Yes, that's true. And that's actually a dream because in Belgium, we don't really count carbs. It's not in the basic education of people with type 1 diabetes. They just do carb equivalence, which is much less in detail. So if we want to have people on pumps, they first have to count carbs. So I'm very happy with all this new data that we can maybe skip that step and just let the dietitian do the calculations.
You mentioned the InPen, and that's just one of the connected pens. You have the NovoPen 6 in Europe. We don't have that here yet.
Yeah.
Are there any other connected pens that you've had experience with?
No, they were so close in launching the SoloSmart pen, like the pen cap, but it didn't happen in the end. And also the NovoPen we stopped using as there was an integration with Libre 2, but then everybody went to Libre 3, and there is no integration with Libre 3. And the integration with Dexcom is not as easy because it goes through gluco. And yeah, people with Dexcom, they don't have gluco. And yeah, anyway. So it was really fun with the Libre 2, actually. I miss it.
Yeah. So you mentioned gluco. We've got a multitude of software that we can use to collect data, generate reports, and help a little bit with the analysis. Gluco being one. We have Tidepool. Also, we got Night Scout, plus all the proprietary stuff like CareLink and Tandem Source. So is there a software? And the LibreView. Is there a software that you prefer, that you find generates the most helpful reports?
I think it's the software that you use the most, because I was just talking to the people from Dexcom. Now we're in the process of switching from Libre to Dexcom.
Yeah, I even mentioned Clarity. Yeah,
Clarity, yes. So I think it's just the reports that you're used to that will give you the quickest insight, because you know where to look and you see the visual directly. And then if you have to switch platforms, it just takes some time. But I guess it's like with pumps, you need like a year to adapt to a new pump also as a healthcare provider to get the hang of it. Yeah. But yeah.
I gravitate towards programs that generate, they call a spaghetti graph, the overlay of multiple. I get so much out of those reports in
but
minimal
you take so
time.
much, you really go into depth, right? You really take your time for your patients. I guess the reality here is we just look at it for 1 minute and then, if we don't really take that much time. And so I guess you're the biggest expert here on the report.
Maybe visually, that overlay, that spaghetti graph just does it for me. Maybe it's just that I love spaghetti and that's what it's called.
Yeah, I always look for the AGP report because I really like Dr. Bergen's style, 1 to 3 steps. Like if you're good, then you're good and it's okay. And then, so I think that's easy. And that report is mostly on every platform. So that really helps.
Yeah, I try to teach my patients how to read those AGP reports as well, and the spaghetti reports when they're available. So I'm going to put you on the spot again. Now, you mentioned before that even though you have all of this expertise, you don't have type 1 yourself. And I was thinking we would vote you into the type 1 club in an instant. And we're pretty meticulous about who we let into that club. But you would be one of the few non-type 1s who would be allowed.
One of the nerds from the type 1 community.
We're cool. Are you kidding?
Yes, the cool nerds. Nerds are cool.
Cool
right?
nerds. All right. Cool athletic nerds. I'll go for that.
Yes.
But if you had type 1, what equipment, what systems would you be using?
So I'm more of a hands-off person. Like I think I wouldn't have the energy to go for the 100% time in range. I would be like, how can I live with diabetes without thinking about it too much? So I think I would go for the Omnipod 5 then.
Okay. Yeah. You might even like the iLet. That's probably the most hands-off system we've got.
Yeah, but I don't think, do you think the iLet is as good as the Omnipod 5? I'm not sure.
In some ways, if you really want hands-off, not thinking about diabetes very much.
I know, but the reason I don't want the iLet,
but in terms of glucose management and having some ability to pull some levers and fine tune on your own, the iLet is lacking. There's no way to accommodate for exercise.
And then if you forget your sensors and then you have a little bit problem there, your pump is not working anymore. And also I don't like tubed pumps, sorry. But this is personal, and I don't want to say anything against the minimalist people. But
that's okay.
It's my pump would drop every minute, so
yeah.
Which actually is no problem because I tested the pumps and it dropped all the time and it didn't break, so that's good.
I had a meeting with Convatec earlier. They make all the tubed infusion sets for all the companies, and we did a survey with our own patients on pumps, asking about tubing, and for the most part, they don't find it to be an inconvenience.
No, that's true. If you ask people on a tubed pump, they don't really mind. I think after 2 weeks, you're probably used to. How long does it take to get used to a tube pump? Because the first days, you really drop it all the time. Couple days. Yeah. Okay. So I didn't do long enough.
It's more a perception that, this tubing is going to be an annoyance.
If you have to change clothes, then you have to put your pump somewhere. And that was the weird part for me.
Yeah. Okay. So you'd be using the Omnipod and the Omnipod 5 most likely with its algorithm?
Yeah. And like last year, I would, or maybe the open source, because now I know how it works. I think the main thing with open source, the main barrier is understanding how it works. But once you understand it, it actually gives you more flexibility, I think.
Well, so they come to us. That's what our team does, is teach people that.
Yes. And I would definitely come to you for virtual support, which is amazing that you support people around the globe. I'm not sure if everybody knows this, but yeah.
We deal with language barriers sometimes. We can handle English and Spanish.
Everybody speaks English, right? Yes.
Not everybody. I wish we had more language capability.
No, because in Belgium, we don't have a lot of people that are using open source. So our knowledge of open source is a lot lower. And having access to experienced healthcare providers who really go into detail like you do, I think it's very beneficial.
Last question. This is for patients, people using these devices. What advice would you give for those who want to really get the most out of the technology that's available?
I think it depends on, do you want to have the most out of the technology? It's definitely like start using an AID system. Don't wait too long, like deciding like which one are you going to use. Just start one, and if you don't like it, choose another. And then if you like to, some people like getting the most of the system, is it getting the best glucose or is it getting the best life and not having to think about diabetes? And I think that's where you decide of which type of system you choose. And also ask your healthcare provider maybe for help, because it also depends. Some healthcare providers are very much trained on specific systems, and it might also be beneficial to choose a system that your healthcare provider is very trained in and not choose a system that he never worked with. Or like switch healthcare provider because of system. Maybe that's not necessary because the connection with your team is also important. But yeah, that's an idea.
I love what you said about don't wait. If the AID
Don't wait.
system is
Just try
available to
some
you,
and
get on it.
yeah.
I describe it to my patients this way. I say, if you're not on an AID system, you're driving a Honda Accord or a Toyota Corolla, but somebody has said, here's the keys to a Ferrari.
Yeah.
And I will trade you. Who's going to turn that down?
Yeah.
You got to be crazy not to do that. And you can always go back to your little car if you want, but who doesn't want to drive a Ferrari? You take
I think it's
advantage
the
of that.
same level. Like a few years ago, we had to put everybody on sensors, and there were so many people say, "Oh no, I'm comfortable with the strips. I will use the strips." And then now everybody's on sensor, and I remind them, "Do you remember the time you had to go on a sensor and you also were doubting?" And then this is the same thing. This is the same step up. Yeah.
Yeah, exactly. I also remind everybody that nothing's permanent. If you try something and you find it's just not for you, just go back to what you were doing before.
Yes.
No one's gonna criticize you if you do that. At least you gave it a fair try. All right, so just a quick summary. What we discussed, technology has come on fast and furious in the diabetes space. And certainly users of the systems need to be up to date on what's happening, but even more so, their healthcare providers need training, education, and build some confidence in how to use them effectively in order to be able to treat patients effectively.
Yeah, and I also want to add, if there's any like healthcare providers who are doubting to start AID systems in their clinic, don't be afraid. It's not that hard as people say that it is. And if you're unsure, you can always check our website, of course. But we are so happy that we started, and we are able to make. There is nothing more fun as seeing a patient back after they start an AID system. It's you're not going to disappoint your patients.
Yeah. And that's the Diabetotech website. And we'll have that information in the show notes for everybody. And also like one of your concluding statements about not just going with the same system for everybody. Each individual needs to match the equipment to the personality.
Mm-hmm.
If you're the type that has certain specific needs to manage your diabetes well, look for systems that offer that. If you're the type that wants a hands-off approach, look for that. If you like being involved and engaged in your management or need to be engaged to fine-tune things, find a system that'll let you do that. And there's a whole spectrum and everything in between, so you have lots of good options.
Yeah, and even if you don't have options, like even if there's only one system available, which is still the case in a lot of centers and in some countries, don't wait, please.
So I want to thank the top expert in diabetes out there, Inga. Thank you so much for joining today. Again, the links to your program will be in the show notes. I'm Gary Scheiner, reminding everyone out there to keep thinking like a pancreas.
Thank you.
Thanks for tuning in to Think Like a Pancreas, the podcast. If you enjoyed today's episode, don't forget to like, follow, or subscribe on your favorite podcast app. Think Like a Pancreas, the podcast is brought to you by Integrated Diabetes Services, where experience meets expertise, passion meets compassion, and diabetes care is personal because we live it too. Our team of clinicians, all living with type 1 diabetes, understands the challenges firsthand. We're here to help no matter where you are in the world. From glucose management to self-care strategies, the latest tech, sports and exercise, weight loss, type 1 pregnancy, and emotional well-being, we've got you covered. We offer consultations in English and Spanish via phone, video chat, email, and text. Want to learn more? Visit integrateddiabetes.com or email info@integrateddiabetes.com to schedule a consultation. On behalf of Think Like a Pancreas, the podcast, I'm Gary Scheiner, wishing you a fantastic week ahead. And don't forget to think like a pancreas.